Morning. In 2006, Governor Mitt Romney in Massachusetts passed a series of healthcare reform bills, a healthcare reform package that later became the basis of the Affordable Care Act on a national level. Today, we're here to announce a series of reforms in Connecticut, a comprehensive attempt at healthcare reform that will blaze a path forward for other states to follow on the issue of healthcare reform. What are we trying to do? We're going to lower the cost of healthcare by 20% for individuals and for small businesses. We're going to do this by transforming the way we pay for healthcare. We're going to lower the price of prescription drugs by bringing in affordable prescription drugs from Canada. We're going to expand Medicaid for low-income adults. We're going to control rising premiums and deductibles with subsidies and reinsurance. We're going to follow other states, and we're going to create a cost containment commission looking at the overall cost of healthcare. We're going to create a new Connecticut option for families and businesses to purchase health insurance. And we're going to pay for all of this by taxing opioid manufacturers, by driving down the overall cost of health care, by restoring the individual mandate that exists in the Affordable Care Act. This year, the Insurance and Real Estate Committee took on a big challenge. We partnered with some incredible partners, and I wouldn't be here if it weren't for an incredible legislative leader, my co-chair, a man who is not afraid of anything, the great state representative from Guilford, Representative Sean Scanlon.
Good morning, everybody.
Good morning. I'm afraid.
The speaker leaned over and said, "I'm afraid of spiders," so that's probably true. Good morning, everybody. This is a historic day for the state of Connecticut. Every single day, somebody comes up to me, whether it's in a grocery store, whether it's when I'm knocking on doors, whether it's my own family, and tells me about the cost of healthcare and how that concerns them, how that worries them, how it keeps them up at night. These are stories that everyone in this room is familiar with because they're the stories that you hear too, even if you're not a legislator or a governor or a comptroller or a senator. Because this is a problem of great magnitude, not just in our state, but in this entire country. And today, we are taking a very bold step towards a transformational bill that will change the lives of Connecticut residents, whether you're a senior, whether you're a small business owner like my mother, whether you're somebody who has kicked off Medicaid several years ago and has been struggling because you can't afford health insurance. Today, we are offering a bold way forward for the state of Connecticut, one that says that we are going to lead with the maximum, that we are going to lower costs no matter what we do. And this bill, which has 7 or 8 key components, every single one of them has one goal in mind, which is to lower the cost of health care for the people of Connecticut. As Senator Lesser said, it's been a great honor for me and him to work on this with our colleagues. Our Vice Chair, Representative Dathan, is here. We're joined by some of the colleagues that Senator Lesser will introduce in a minute. But this effort and what we're announcing today would not be possible without the help of our governor, Governor Lamont, without the help of our legislative leaders, Senator Looney, Speaker Arasimowicz, and State Comptroller Kevin Lembo. And for the last 3 or 4 weeks, we have been negotiating this bill. And I am very proud to say today that what we are going to present to all of you and the people of Connecticut today is a very simple concept. And again, it to lower the cost of health care, to lower the cost of prescription drugs, and to make sure that we are making a big dent in the worries that are going on all across the state right now as we speak of people who are afraid of getting sick because of the cost of health care. So thank you all for being here today. Thank you to my co-chair, Senator Lesser, and thank you to everybody make this happen. We have 2 weeks to go in this session. Let's pass this bill, and let's change the way we do health care in the state of Connecticut. Thank you so much.
Thank you, Representative Scanlon. As we mentioned, this bill does a lot of things. It is the most ambitious health care package any state has considered. But one of the things that it really does is it helps those folks who are falling through the cracks. And we're going to hear from one of those people right now. Shomit Sagupta is a home care worker who has had trouble finding affordable care. Shomit, will you tell your story, please?
Hi, good morning. As you heard, I'm a home care worker in the state of Connecticut. I work in New Britain. I care for an individual who's got an acquired brain injury, and he's a student at Tufts University, and I take care of him. I drive him to school. I help him with organization and with note-taking, and also with helping him get to places on time and helping him with navigation. I also take him to festivals, concerts, museums. I basically help him have a social life. Without me, without people like me, that would not be possible. He would have a very difficult time going about his activities and pursuing his education. Thanks to the efforts of the union, workers like myself now make $14.75 or $15, depending on our role. And we will soon be making $16 as the months go by. While this raise will certainly allow me to live a more comfortable life, it's still not enough. It's still barely enough to get by. And so I am seeking more work. I'm in the process of picking up new clients, but doing so will put me in a different income bracket. So right now I qualify for HUSKY D, but as soon as I pick up a new client, I'll be forced to seek alternative health insurance through the private marketplace, where I'll be forced to choose plans weighed down by massive deductibles and out-of-pocket expenses. HB 7267 and SB 134 will help workers like me by creating new and affordable healthcare options with more manageable out-of-pocket expenses and deductibles. This bill is absolutely critical in ensuring that hard workers like me that are taking care of your relatives and loved ones get by in life. Connecticut's hardworking residents will have access to healthcare insurance that works within their budgets, and they will not be driven out of poverty. Thank you very much.
Could you spell your name slowly, please?
SHOMIT. Last name SENGUPTA. GUPTA. Sierra Echo November Golf Uniform Papa Tango Alpha. What? New Britain. Yes.
New Britain.
New Britain. Thanks.
I'm also going to spell everything out phonetically for the rest of the day. So we wouldn't be here in many ways if it weren't for one particular statewide elected official who's made healthcare the centerpiece of what he does. And he is a policy wonk, but he's also someone who's really committed to the bigger issue, which is making sure that healthcare is a right that everyone in the state affords. And he's willing to put the work in. And we went together to a church in Waterbury to help sell the need for reforms a few weeks ago. And nobody has been more at the center of this conversation than our State Comptroller Kevin Lembo.
Good morning. Thank you for being here. Whether you're just curious, or you really want to know what's going on, or you may have a dog in the fight, thank you for being here. It's an important conversation, and it's been 10 years in the making. And as I've said before, many of us were standing in this room a decade ago. And I'd like to say that things since that time have gotten better, but frankly, they have not. Things are worse. So here we are. And with this sweeping history of where we've been and what we've tried and what we've considered, we have likewise put a piece of legislation on the table that is, in fact, sweeping. Historic for Connecticut, historic for the nation. Walk around the building and ask elected officials to tell you something about small business, and they will say something like, Small business is the engine of our economy. And then ask them, what have you done about that? And you'll get a mix of answers around economic development and some other things. But I'm here to tell you from a broad-based perspective, this thing we are doing today is the most significant thing we can do to help small businesses to grow and prosper in Connecticut. The bill has the potential to change the trend on medical costs. It has the potential to change the trend on increased deductibles and pushing people further and further away from care while they're simultaneously paying more and more for the underlying policy. And it has the potential to, in a positive way, disrupt a market that is failing. By monitoring costs and identifying outliers, by offering new coverage options with the heft of the state purchasing behind them, while increasing affordability, both on the exchange and off the exchange, through state subsidies and a reinsurance pool, and while driving down prescription costs through a number of measures up to and including reimportation from Canada. I'm honored to be here to work with this group of legislators and executive officials who care deeply about the future of this state and are very aware of the potential we have if we are simply able to create an easier and more receptive environment for businesses to come and grow. I want to thank the governor for being here and for his staff and their work, to the Speaker and the Senate President, Joe Arasimowicz and Marty Looney and their staff, to my partners in crime, Senator Matt Lesser and Representative Sean Scanlon, to Senator Cohen and our other legislative colleagues who are here today, to the advocates and the business owners who took time from their work to come to this building to tell their story that is compelling. They don't have high-paid lobbyists to carry their story to this building. They made time to come here and do that. To Tom Swan from CCAG, to Francis Padilla, Lynn Ide, and others from the Universal Healthcare Foundation, to Nora Duncan and AARP and John Erlinghauser. And I'm going to close by just thanking my staff, Josh Wojcik, our policy director, Millie Torres-Ferguson, Betsy McDermott, Tara Downs, and Tyler Van Buren from our communications staff, to Miriam Miller and Tom Dubin, our Yale interns, and to Michelle Halloran-Gilman, Marty Carlson, and Natalie Braswell. Those are the folks behind all of us who help us get the work done, and they're not often recognized, so thank you. I appreciate the work.
Many of us are familiar with a usual path of legislation, which is it starts off strong and then it gets watered down. I think this bill that we're talking about went the other way, and I think they did so for one particular reason. And in January, when we introduced legislation, it was aimed at really one issue, which is the cost of insurance. But through the legislative process, we started realizing that that is one important issue, but it's not the only important issue. And now we are looking at a comprehensive health care bill. And the biggest reason for that is because we have a governor who comes out of the world of small business, who understands that the cost of health care is directly tied to our business competitiveness, and that we have to tackle health care costs overall. And I am so thrilled that we are here, we've achieved consensus, and we're moving forward. And we wouldn't be here if it weren't for some extraordinary leadership out of the governor's office and a willingness to take on a tough fight. And so I'm going to bring up the governor in a second. I do want to acknowledge just a couple of legislators beforehand, Representative Turco, Representative Hughes, Representative Horn, Representative Johnson, and Senator Anwar. But we're thrilled to have the support and the partnership of the governor of the state of Connecticut, Governor Ned Lamont.
All right, good morning, everybody. I'm Ned Lamont. That's L-A-M-O-N-T. I want to, first of all, to Matt and Sean and my favorite policy wonk, Kevin. You guys have taken the lead on this and shining a light on a problem that's been festering for many, many years. And this is a bill that gives us the best opportunity in a long time to expand access to people who don't have access to affordable health care and to bring down the costs of health care. And Kevin and Matt both mentioned that I often look at these issues from the point of view of a small businessman. So let me tell you, I mean, I had a small business, and we had to compete. We had to compete with Verizon and AT&T and the big guys. They had amazing benefits out there, and they could buy health care at a lot less cost than I could. And I had to do everything I could to make sure that my folks had the health care they deserved. So for me, this is the type of bill, as a small business person, I would embrace. It makes affordable health care available, real quality health care, and allows me to compete with the big guys. And small business is the economic engine of our state. And that's one reason I find this so important. I'll just say one other thing in terms of groups that haven't been mentioned. The way I like to govern, I think is a collaborative approach. I like to work with all the different stakeholders out there. And I like to work in terms of the public-private collaboration as well. First thing I did was when we found out that we had federal employees that were being kicked off the payroll for no fault of their own, we came up with a plan working with the banks to come up with a solution to provide interest-free loans. Well, we worried that wind power was going to stall out in southeast Connecticut. We weren't going to be able to get that done. We worked in a public-private collaboration to make wind power a reality in that part of the state and for our entire state. Yesterday, we had a good debate back and forth about paid family and medical leave. And to me, it was very important that we do this in the most effective and efficient way. Again, a public-private collaboration to get this done. And what I think is important about the Connecticut option is we're working with the stakeholders. It's going to be overseen by the folks here in this room as we look at what we got to do. And I've worked very closely with the insurance industry as well. This is the insurance capital of America. And make sure that we can come forward with a program that brings down the cost 20% or more over the next 5 years in a collaborative way going forward, working together. And I got to tell you, I'm going to put my shoulder to the wheel to get this done. It's a big program. It's a big program, it's an important program, and we can study it, but we got to get it done. I'm on board. Thanks, everybody.
Thank you, Governor. This bill is about political consensus, but it's also about human beings. And one of the important parts of it is that we are expanding the HUSKY program to bring back families that have been kicked off HUSKY over the last few years. That is going to make an immediate difference in the lives of people in this state. Joanne Johnson is going to be up here and tell your story, please.
Good morning. I'm a family provider, a child care, and one of the things I hear all the time from my parents is that it's hard to pay for insurance and work and pay for child care. Majority of my parents are involved with Care for Kids. So in expanding this program, you secure the health of all these small children. I've gone to doctor's visits and I've taken care of sick children because parents can't take off the time. Making sure that our children are covered by this bill makes my job a lot easier. And I appreciate you standing by and voting for this bill today. Thank you.
Thank you, Joanne. Nobody who watched the debate over the Affordable Care Act or any of the previous fights over health care ever came away saying that they thought health care was easy. That wasn't one of anybody's takeaways. But my job in the Senate has been a lot easier because of a lion of the state Senate, someone who's always fought to make sure that people have a right to health care, who has taken on this fight for many, many years and continues to do that. Our great Senate President, Senator Martin Looney.
Thank you so much, Matt. I am really excited about the prospect of what this offers for the state of Connecticut. What we are seeing under the leadership of Senator Lesser and Representative Scanlon and what they have worked on to build consensus and the leadership that the governor is showing on this issue and moving Connecticut forward really points out another opportunity for federalism at work and how our federal system can operate when states can take the lead. Frankly, the Affordable Care Act, as I think significant and important and just hugely hugely transformative it has been in so many ways, fell short in one respect, and has left to the states the option to develop an alternative to the other plans that are available under the Affordable Care Act. Connecticut will be taking the lead in this area, taking advantage of states to be the laboratories of democracy to move forward with a state-created plan, the Connecticut Option. So I am thrilled at the prospect of that and how the bill has actually, as Senator Lesser said, gained momentum as we've gone along in the session and gotten stronger as we've gone along, and is actually going to be just a hugely significant contribution to the peace of mind of the people of this state. Thank you.
We have one other legislative leader here who's kind of important, and he's very important. Who put in the first bill, I think, this year to expand access to health care in the state. And it's our hope that very soon this bill will be running through the State House of Representatives, and that's only because of the strong support we've received every step of the way from the Speaker of the House, Representative Joe Eristomowicz.
Today I'm here, really, typically I'm the coach, but now I'm the cheerleader. The amazing work that's been done by the chairs of the Insurance Committee, Senator Lesser, Representative Scanlon, Kevin Lembo, is amazing. This started with a meeting in the leader's office with the chairs with a basic concept. Is healthcare a right or a privilege? We landed on a right. And today is the step forward that we need. Today is the step forward to make us more competitive in business, but more importantly, provide a quality product to the residents of the state of Connecticut. I cannot thank the governor enough for bringing his expertise and the public-private partnerships and his willingness to listen to us. This is how things get done. They get done by teamwork, and that's what we're on hand to see today, and I can't thank him enough. Thank you.
Next up, we have Nora Duncan from AARP, who's going to talk about how this program will help lower prescription drug costs for seniors.
So that's spelled A-A-R-P. I know how happy the press is when you're like at number 9, so I'll make this brief. I want to thank everybody for all of your support and your help on this. The dedication has been tremendous and the cooperation has been tremendous. The United States people in the United States pay the highest prescription drug prices in the world. It's time for Connecticut lawmakers, everyone, to create a drug importation program that would allow pharmacies and pharmacists to import drugs from Canada. Drugs sold in the United States can be up to 10 times more expensive than drugs sold in Canada. Canadian pharmacies and other imported drugs are safe, and the high prices that U.S. consumers pay really function to subsidize what we pay in other countries for the same drugs. Drug importation is a bipartisan issue. Florida, Colorado, Vermont have all passed this. Maine, Minnesota, and Oregon are all working on this. It's time for Connecticut to join in and create a purple slushie that we can send to HHS to get this done before 2020 is over. And, you know, to reiterate this a little bit, 40% of seniors polled indicate that they are struggling to choose between paying for their medication, their food, their housing cost. 40%. And to reiterate the bipartisan issue of this, just yesterday I heard from a constituent in Senator Kelly's district telling me that she had a group of seniors that she was concerned about were not taking their medications as prescribed and were choosing between food and drugs. We've got to stop this. It's time. We have a great opportunity to do so, and I'm thrilled to be a part of it. Thank you.
Thank you, Nora. AARP has been a fantastic partner with us every step of the way. But our last speaker is really about a big chunk of what this bill is about, which is providing lower costs for small businesses and nonprofits. And with that, I'd like Seth Powers to come up and tell his story. Thank you, Seth.
My name is Seth Powers. I work with the Center for Children with Special Needs, which is a practice in Glastonbury that provides consultative and clinical services for children, adults with neurodevelopmental disabilities, including autism. For 25 years, we've been working in Connecticut, and we have a staff of almost 40. A core value of our organization has been to provide health care for our employees and their families so that we can take care of their families as well as they take care of our patients' families. The ever-increasing costs of providing the health care to employees has put a burden on our business and other small businesses within the state. As cost sharing has skyrocketed, businesses' ability to increase wages cannot keep pace to offset the annual double-digit insurance cost increases that employees face, leaving employees to bear more of the cost and reducing their ability to otherwise contribute to the economy here in Connecticut. Small businesses are the lifeblood of the economy, and they deserve the same consideration afforded to large industry, both here and at a national level. Unlike large companies, small businesses don't have dividends to reduce. We don't have share buybacks that we can put on hold. There's only 100 pennies in a dollar, so if we have to spend more dollars on healthcare, there are fewer dollars that are able to go into the business that support innovation, hiring, growth, and investment. I commend the team behind us and all those around the room for letting small business have a voice at this table. I look forward to continuing to be a part of whatever the solution is going forward, and I would hope that Connecticut works to take these challenges seriously so that the small businesses in Connecticut can grow to become the next large businesses in the Nutmeg State. Thank you.
Thank you. I assume there are not any questions, but if there are, happen to be a couple, we'll take them.
Why don't we start with, well, let's not have Mark take the first question. Why don't we start with
the first question.
What is the implementation
We'll get to both questions. So we're looking for the Connecticut option to be available in 2022. There are parts of the bill that will take place that will go into effect sooner than that.
Since this was the concept of a famous Republican, where are the Republicans in this room right now?
Having positive conversations with my Republican colleagues, I had one last night. We're going to continue to try to build consensus on this. This is obviously the result of a lot of consensus, and hopefully we'll have more to announce soon.
Christine, yeah.
So this no longer pools small businesses with the state employees' health insurance plan. So how does this save costs?
The plans are going to be designed by the Office of Health Strategy with a guaranteed 20% reduction in cost based on their plan design and the networks that are designed through those plans. And so where you would have maybe seen savings in the state employee plan through the way that we were originally doing the bill, we are now going to find that savings through that 20% in design. And so when we see that go on to market January 1, 2022, a small business like his can go on to get a plan through the Connecticut option, and they will immediately see a 20% reduction in the cost of their premiums compared to 2020.
So
that's the benchmark.
How many plans do you plan to offer?
That is determined to how many plans decide to bid on this.
Okay, so it's going to be open to.
So it's
whatever
designed. It's
insurance
designed by the Office of Health Strategy, and then it kicks to the comptroller, who can talk about his piece of this.
I'll just say, Christine, it really is going to depend on the price points that we can get to, right? This is about finding savings and offering good care first, and then making sure the price is right. So if that means 2 carriers, or it means 4, or it means 1, I think we need to be open to all of those possibilities.
Kevin, can I go on to Christine's question? If Sean or Matt want to answer it too. If you begin with a premise of 20% saving, you still have to have some assumption that you know the market well enough to know that the plans are not going to be lesser in quality than what's being offered on the exchange at 20%. So how confident are you that 20% savings and plans of higher quality are pretty much assured?
So look, that's why we have actuaries. And part of the analysis on the front end, that's why we have a 2022, I always blank on the date, sort of startup, so we need some time to plan that out. But in simplest terms, Keith, when you look at the admin load, administrative load on a plan that I run versus a private sector plan, it's easy to get to 10 to 15% savings just on the admin relief alone. Beyond that, we're going to announce, I hope, in the next couple of weeks, the results of our RFP process around pharmaceutical benefits that has the potential to bring tens of millions of dollars of savings into that line as well. We continually drive down costs by doing things smarter and better. That will bring relief to the group that buys insurance through this pool as well, or through this group as well.
Will not be offered on the exchange.
The plan is to on and off, but yes, it could be on. It could be on.
Or off.
Sure. Yes, I will. I'll answer that question in 1 second. I will also just say that the plans that are currently operating on the exchange will also offer this plan as well. So this is this is a true public-private partnership. We're looking right now when you look at reinsurance, when you look at wraparound subsidies, we're looking at about $100 million in total cost. But that is not for the operation of the program. That's to help people afford their health. What's that? The actual operation of the program is about $1 million. No, just $1 million startup, one-time startup cost. Yeah.
And then regarding the individual mandates, I mean, how much money are you expecting that to bring in?
Conservatively, about $25 million.
What will be the fine if you don't have the individual mandate? What is the tax on the opioids?
So we are using the exact same individual mandate that existed under the Affordable Care Act. We are simply restoring things to the way they were 1 year ago, and 1 cent per milligram. And then the tax on opiates is 1 cent per milligram, but it is not on the retail level. It is on the first point of sale. So we're really going after manufacturers.
And then what does the insurance industry think of this? I mean, the additional fees on the insurance industry. I don't know if Governor Lamont has had any conversations with them, but I can't imagine that they'd be happy to contribute any additional money.
Well, I may have had a couple of conversations, Christine. We've been talking through this for a while. Somewhere back there is a guy named Johnny Dock who's been doing this every day for about a month. He really deserves his Memorial Day weekend. Look, they're going to look at the final language, but we've had good, constructive. I wanted them at the table, and I want them at the table as we think about what we do going forward. And we need them to make sure they're on this exchange and ready to bid on this and go forward.
Well, are they on board or aren't they?
I would not say that they are on board with anything. I think that we are having productive dialogues that are constructive, and I would classify them as constructive dialogues with them. This bill has come a long way since Matt and I held a hearing in the room across the hall on the original bill, and we've been talking to them for months.
They want to see the final language.
And they want to see the final language, and we work with them on that.
We also asked them, how do we lower the cost of healthcare? And so a lot of what's in this bill is ideas that came from the insurance industry. We listened to them, and I think what you're seeing right now is a bill that is looking at everything. It's looking at providers, it's looking at pharmaceutical manufacturers, it's looking at pharmacy benefit managers, and it's looking at insurance. We're not leaving any part of the healthcare system off the table. We're looking at everything.
How about housekeeping question? Is there an actual amendment, an actual fiscal note somewhere on the line that afterwards we could find out about, look up?
We'll have that very soon.
How about pharma? What is their reaction to this?
Sure. I think they're prepared to live with it. Yeah, I think we've had some conversations with them. As of this morning, I heard that the pharmaceutical industry in Connecticut is okay with this language.
Can I just go over how the capping system works? Because you talk about if a provider, insurer, somebody in the process, drug manufacturer, goes over the cost growth cap, they have to submit a plan to come into compliance.
Yeah.
But how hard is that cap? Could somebody take 5 years to drive their costs back down under the cap? How do you enforce it?
I don't think so. I think that what we're setting is an aspirational goal for healthcare spending across the state, and we're setting a benchmark. And we're saying to the different stakeholders that are part of this, whether it's a PBM, whether it's a drug company, whether it's a hospital, we are all seeing massive healthcare spending in the state. And we want to set benchmarks in order to sort of see where we are and where we can get better for the benefit of all consumers and the entire healthcare system. If they don't meet that benchmark by a certain time, the OHS can hold a public hearing where the folks can come forward and explain why they didn't meet the benchmark and what they're going to do going forward to try to attain that.
Well, what happens if the state decides you really aren't making a good faith effort? Do you take it beyond that point, or are you just hoaxing them?
Absolutely. And one of the things we recognize is this is not the last bill Connecticut's going to pass on healthcare. So we have a continuous process in this bill for coming up with new, stronger laws to address problems in healthcare as they come up. So we're not pretending that we're going to be able to say, hey, healthcare is solved. We can go home and focus on other things. We're going to come back year after year, and that's part of that's in this bill. That's what the commission is going to be looking at, is looking at new problems as they come up, helping control the cost of healthcare, making sure that we can afford it going forward.
Just to be clear, though, there's no sanctions right now.
No.
Okay.
So Keith, I just want to follow up real quick. Look at the Massachusetts model and you'll see it doesn't have what you'd call a lot of teeth in it, right? But it has a lot of discussion, a lot of public hearing, and a lot of things that so folks would like to avoid. So it has been successful without the need to have sanctions on the back end. But if we need to get to that point, you get to that point. I think we should follow in the model of Massachusetts. I'll also challenge the room just a little bit. Some of the questions coming forward is like, what does pharma think of this? What does the insurance industry think of this? Folks have spoken to all of those people. There's been ongoing conversation. Some things they like, some things they don't like. We're going to reach a point of compromise or not. But it's not like this is happening out of nowhere. And don't assume the old way of doing business is going to rule the day. Just because one important lobby or one important piece doesn't like it doesn't mean you can get them to okay. It's too important to walk away just because there'll be a powerful interest against it.
And further, I would say, the loudest voices that all of us are hearing are not from lobbyists, they're from our constituents who are fed up with the high cost of health care. And so, industry is important. We've been talking to them all day long for 3 or 4 weeks. But it's the constituents that matter the most to me, and that's the people of Connecticut, and they want to see this happen right now.
Well, one of the points that was made on Tuesday by the insurance industry is this is the insurance industry in Connecticut. It's not just a lobby. Someone said this is like the Michigan legislature dealing with the auto industry. It's like the California legislature dealing with the silicon industry. How do you square that with the state? This is just another lobby.
I said because we're calling this the Connecticut option for a reason. It's a Connecticut-specific solution to a problem that involves the public and the private partnership here. And so I think that to say that the analogy that you gave that Michigan, that's not fair for this. I think this is a very specific Connecticut option that's tailored to make it work in Connecticut to help our constituents and make sure that we are not at odds with a very important industry. And we've found what I would characterize as the symbiotic balance between those two things.
Thank you.
You've got, what, a week and a half left of session. Can you get something, this sweeping, this change across the finish line?
Yes. And thank you, everybody. I think some folks have some tight schedules. Thank you very much for being here. Keep going, man. Thank you. Thank you, Governor.